Learning disabilities is a developmental disability where children with learning disability often have difficulty in academics, which involves reading, writing, math and spellings, and sometimes these difficulties may go beyond academics and affect their thinking and the pace of thinking and problem solving in daily life as well. So the early signs of learning disabilities can involve the child not being able to remember what is the child is being taught. It can also mean that the child is not able to figure out or connect one learning to the other in different contexts. Sometimes children with learning disabilities find it very hard to follow multiple step instructions. They might be finding it hard to scan through and differentiate between different kind of objects, and these are some of the warning signs at an early stage that it's important to keep in mind and observe more to understand whether the child might be having learning disabilities. That doesn't mean that children with learning disabilities cannot do well in life. They are smart or even smarter than other children, but they need the required support to be able to learn to the best of their potential. It shouldn't be confused with learning difficulty. Learning difficulty is something which is different. When there are people or children who have intellectual disability, when they take a lot of time to understand anything that is being taught to them, or maybe they have a visual impairment, or they have a hearing impairment, or there is an emotional disturbance in their family, it is hard for them to make sense or gather the learning or the stimulation that is happening around them, and therefore the learning can actually not happen to the extent possible for that particular child. Now this is different from learning disabilities. In learning disabilities, we take into account that there is no emotional disturbance, there is no abuse or neglect from the family side. The child is not having any kind of visual impairment or hearing impairment or intellectual disability. The child has gotten the exposure of going to a school and learning from teachers there. But even after all these factors taken into consideration, the child is not able to learn and perform the way the child is expected to. And that's where learning disabilities start coming in and they play a role. The three types of learning disabilities are dyslexia, dysgraphia and dyscalculia. Dyslexia is basically the difficulty that the person faces in reading and in comprehending what the person is reading. Many times children are able to read very well. They can read line after line, words after words, but they are not able to understand what they are reading. If questions are asked to them, they are not able to answer correctly. Many times there are also children who find it very hard to just read a word. They might be finding it hard to even learn the letters before reading words. They cannot remember them, they confuse with other letters. So if this happens on a regular basis, and even after teaching a lot of time it continues to happen, then the child might be having dyslexia, and therefore closer look is required to keep a watch on the child in terms of how the child is progressing. Dyscalculia is to do with numbers. In numbers, when we say numbers, what we mean is that the child is finding it hard to learn about numbers. The child might be finding it hard to do calculation with numbers. The child is finding it hard to do the word problems in math, and of course finding it difficult to apply the formulas and solve problems when given to them. The difficulty can happen in any one area, it can happen in many areas at the same time. In dysgraphia, it is to do with spelling and writing. When we say spelling, it talks about basically learning the spellings of the words and being able to write the spellings correctly all the time. Sometimes children find it hard to write the spellings individually, but they might be finding it okay to write it in a passage or a sentence, and it can be vice versa as well. In writing, we not only talk about handwriting, but we also talk about about the creative writing piece. In terms of creative writing piece, the children who have learning disabilities and dysgraphia, they might finding very hard to make sentences properly. They find it hard to organize their thoughts and put it in an organized manner on the paper. There might be difficulties in terms of using the punctuation marks, the full stop, the commas and question marks. The thoughts may not follow in a synchronous manner on the paper and the events might look jumbled up. In terms of handwriting, the handwriting may not be legible all the time. There might be lot of spacing difficulties between letters and words on the paper, and it might be sometimes difficult for others to read and understand what the child has written. Learning disabilities can also affect a person's thinking and the speed of solving problems, and therefore learning disabilities can impact a person beyond academics. Of the school context, when children with learning disabilities, they are in a playground playing with other children, they find it hard to follow the rules of the game. They find it hard to understand the sequence of events in a game, and sometimes because of that they are not able to play the way they are supposed to like other children. There is a category of learning disabilities where children or people with learning disabilities might have other disabilities along with learning disabilities. They might be having attention difficulties, they might be having autism, they might be having cerebral palsy. In these cases, sometimes the learning disabilities is magnified and sometimes it becomes like a profound and a severe learning disability, because here there are two disabilities that are actually playing a role, and therefore it becomes very difficult for these children to be able to learn and perform well in life. They do require regular support for themselves, but if done on a regular basis and consistently and from a very young age, then they are also very much capable of leading their lives independently and also be involved in a lot of community and society activities. Diagnosis of learning disabilities follows two-step process. The first step is to go to a developmental pediatrician, where the developmental pediatrician looks at the child and through different activities are able to say whether the child has learning disabilities or not, and therefore recommended to different therapists for therapy. At the school context, it is a little different in terms of the assessment. Proper assessment needs to be done for the child, which happens in government hospitals and in organizations, and it's a two-way process where an IQ assessment, the intellectual part of it, and the educational part is assessed through standardized tests and norm-based tests by licensed and trained special educators and psychologists. And once these assessments are done, then they are able to understand whether the child has learning disabilities or not. The intervention for children with learning disabilities can be many. It starts with, of course, with the diagnosis part, but then it goes into different kind of therapies that the child might be required for. It can be occupational therapy, where the child is supported in terms of the gross and the fine motors. It can also be in terms of the special education, who looks into the academics of the child. It can also be parents and teachers who play a vital role in just bringing up the self-esteem and self-confidence in children and making them aware that they are doing well in their life and what are their strengths, and to build on those strengths and not just focus on the challenges that the child is facing. If you found the video helpful, do like the video and subscribe to our channel.